To Alex Easton on ABC Radio Queensland.
Now, 70% is supposed to be the magic number for our vaccination rollout. That's the point where restrictions can be eased across the nation and people, particularly in the lockdown parts of Victoria and New South Wales, can return to some semblance of normal. But a new draft report from the Royal Commission into Violence, Abuse, Neglect and Exploitation of People with a Disability says that's not going to cut it. They've just released a draft report. They're saying the uneven nature of the rollout leaves Australians living with a disability vulnerable if governments relax once 70% of the eligible population is fully vaccinated. River Knight is the co-founder of Developing Australian Communities and has more than 2 decades of experience in disability advocacy. G'day, River. It's pretty unusual for the Royal Commission to release a draft report like this, and this one's quite damning. Why do you think they've done it?
Hi, thanks for having me. I guess what I'm seeing for this is an entity like the Royal Commission really wanting to focus on a really hot topic. So I think within that Royal Commission outcome, there's going to be a lot of things systemically that we all know in the sector needs to be addressed. But the particular topic right now with COVID and the vaccine rollout, which has been an absolute schmozzles, is a hot topic, and it's a very pressing topic because it's something that's going to put people's lives at risk. And I think that's why they've taken that stance to say, you know what, we need to release some draft outcomes here to make sure that the government who are about to do something don't get something wrong that could have such catastrophic outcomes.
Now, this draft report comes with recommendations. There are 7 of them, in fact. And from my reading, it looks like the most pressing of them is that no state or territory ease restrictions, even if they reach 70% vaccination rate, until the federal government is satisfied that all people with a disability and their support workers have had the opportunity to get both shots. Can you explain why this is so important?
Well, I think what I'm hearing from people, and also very much from the Department of Health, is that the most vulnerable parts of our community are the ones that are most likely going to have a terrible outcome if they have COVID. So the ones that are highly likely to have, complications with their health are people with some significant disabilities that we have in our community. So they are the people that are often at most risk, and they are the population that right now we have had the worst result when it comes to actually trying to help people get vaccinated. And it's the population that's having the most difficulty accessing the vaccine because they need that support to actually get there sometimes. And if I have a physical disability, I'm going to need extra support to get into it. And we just simply don't have the resources being put into it. And that's what we saw when we had the original rollout plan, where they dropped disability as a target population and put all their efforts into aged care without telling anyone.
Yeah, so that's one of the findings that was in this, is that the people in residential accommodation with a disability were deprioritised in the vaccine rollout in favour of the aged care sector. And it took 6 weeks for the Department of Health to be transparent about that decision. I mean, does that come as a surprise to you?
It's a really disappointing one, but it's when it comes to the bureaucracy that we often work in any sector, it's not always surprising, but it was incredibly disappointing because I know a lot of service providers that had a lot of communications coming out saying, get ready, we're going to go, you are a target population, you are the top tier, you are the population, your staff and participants that need this vaccine because you're the most likely population that will have adverse outcomes. And then everything stalled and went quiet. And I know in the disability sector, we were all kind of scratching our heads going, so what's happening? And my staff were saying, hey, I'm trying to register to get vaccinated and there's no appointments. And the reality of that is that as a sector, we were ready to respond rapidly. And a lot of people put resources into getting ready for that. And then just the ball got dropped.
And we're now in a situation where there's obviously been a lot of advance made in the aged care sector in particular, which has had a lot of attention. But in the disability sector, we've got, I think it's something like 66% of people in shared accommodation who have a disability, have had both shots. And amongst support workers, it's 56%. Like it's well down on what you'd worry about. And When the Royal Commission started, part of that was about, well, disability has been this invisible thing and we need to have something that puts a spotlight on it. And this was the federal government saying that. Yet now you've got Barnaby Joyce telling off Anastasia Palaszczuk for not following the Doherty model when she makes noises about, I'm not sure if we should be reopening yet.
And unfortunately, it's become a bit of a political hot potato too. We see the Labor states doing fantastic with their response with COVID in terms of the numbers of people currently experiencing COVID, and we see the Liberal states with different numbers. And unfortunately, it's hard to not want to say it's political, and we hope that it's not. But the reality is those statistics, when we talk about group accommodation, we're talking about a definition that talks about 3 to 4 people that aren't related that are living together, so group homes. The majority of people with a disability are not living in group homes, and the majority of the people that we're trying to vaccinate are not those people living in a group home where I can have a nurse go and vaccinate four participants with a whole bunch of staff. The majority of people with a disability are not in that group home setting and are still not vaccinated.
And we have seen in the aged care sector, and sorry to keep harping that comparison, we have seen the home care workers have vaccination rates much, much lower than in the aged care homes. So I suppose maybe that mimics that in an unfortunate way. But we are seeing also calls for mandatory vaccinations for disability support workers, which is something that's already happened in aged care. Why do you think this has not already happened for disability services?
Well, I think that we can't really mandate and say that something must be done if you don't have the resources to do it in the first place. So I know people that have been working in the disability sector that have only just been able to get their appointments to get their first vaccination in the last month or two. So it's a little bit rich when we sort of say something's going to become compulsory when you can't actually get it in the first place. So I think the practicalities of a disability population that's very spread out are very different than going to an aged care setting where I can have, say, 200 residents in one space and then a whole bunch of staff that can come in. We've been saying to people, why don't we treat this like an election? Why don't we get every high school, pop up a vaccination clinic with a nurse and spend a couple of weeks getting every single person that can possibly get to a high school or even a shopping centre, get it done.
This is a very high-profile whistle that's been blown by the Royal Commission. Do you think it's going to have much of an impact?
Look, I think it's about highlighting a topic and highlighting a problem that often gets swept under the rug. It's a group of people in our community that often are devalued and are not always seen and are not always great at speaking out for themselves. So what we want to do is really shine the light on and say, hey, you're about to roll out. We understand the economic pressures. We understand the community pressures, but don't forget the people that are on that pointy end, the ones that are likely to have the contraindications, the ones that are going to be having difficulty with, COVID, if they do get it, they would probably end up in hospital. They're the ones that we're actually failing right now. So they're the ones that we really need to be focusing on. Let's value that population that's going to be the hardest hit.
All right, River Knight, thank you very much for your time this afternoon.
No worries. Thanks for having me.
All right, cheerio. That's River Knight. He's the co-founder of Developing Australian Communities and a disability advocate with more than 2 decades of experience.